I'm Dr. Shantanu Tandon. I'm a senior consultant and airway specialist in the Department of ENT at Sakra Hospital. So I'll be talking today about swallowing problems, especially in old patients. So once we've seen and examined these patients, one of the most important ways of assessing them is to do something called a flexible endoscopic evaluation of swallowing, or a FEES. Now what we do in this is we pass a thin small flexible camera through the nose and have a look at the throat. Then we ask the patient to swallow a variety of different food particles and solutions. They're of different consistencies, and we are able to observe where the food is going, where it is getting stuck, and is it by mistake going into the breathing passage. Now all of this is important to understand where the problem lies, but it's also important to understand whether it's affecting different parts of the airway or any other complicated problems which may be coexisting. We'll sometime also do a test called a barium swallow, where we can use a dye and see where the dye passes through when we are swallowing it. But finally we need to know where the problem is, and then we need to start working on it. Now usually we work on it alongside a swallowing therapist who can work by doing certain exercises and teach certain maneuvers which more often than not will solve the problem. Rarely we would have to do some small surgical intervention to release any tightened muscles, but more often than not, like I mentioned, we can treat this non-invasively.